Academy classes differ from other courses, specifically English courses, in that there is the healthcare focus. So in junior and senior English with me, we're going to take a look at different ethical dilemmas. We're going to do the same activities, the same type of writing. We're just going to do it with more of a focus on healthcare and healthcare issues.
And so English 10 in the Health Academy is a bit different than English 10, CP English 10, in that everything we do focuses around either healthcare or patient care. So there's an overall focus to the class that makes it a bit different.
The class of Anatomy and Physiology is the study of the body and how it works, which pairs really well with Advanced Med, because in Advanced Med they're doing work with patients and they're going through steps and procedures. And in physiology, we get to actually take what they're learning and apply it. So they know what they're doing, why they're doing it. They understand what the patient is going through on a biological and sometimes molecular level.
There are a lot of opportunities in Advanced Med. It gives the students a chance to kind of see what healthcare is all about. That's one of the main opportunities. And it's also a chance for them to see possibly what nursing school is all about and medical school, or perhaps they want to be a CNA. So it gives them a chance to kind of be in a class where they have an opportunity to practice skills, learn skills, and actually interact with the hospital staff. The students get to basically rotate into 9 different departments, so they get a chance to see really what healthcare is all about. Some students think they just want to be in pediatrics, but it gives them a chance to see what oncology is about, working with cancer patients, or labor delivery, and watching basically babies be born, or working with in the surgical department where they actually get to go into an OR and watch a surgical procedure being performed.
Medical Trends is the culminating class of the Health Academy. It's a class where we focus on healthcare issues both locally and globally. We help kids through the college application process, and we do the infamous patient simulation.
Medical Trends is a class that you take as a senior in the Health Academy that is meant to bring all of the health things that you learn and apply it to real life situations. Like we did a project where we looked at pandemics around the world that have happened through history. We also did a project where we look at the healthcare systems that are around the world.
Hospital practicum is basically an internship opportunity during the spring of your senior year where you can go for your 3rd to 4th or 4th and 5th periods and go to the hospital and job shadow and perform different tasks that you perform during your junior year during advanced medical sciences.
Hospital practicum is an extension of Advanced Med. It's a course that our students enroll in after they've completed Advanced Med, so it usually happens in the summer between their junior and senior year or during their senior year. And it's a chance for them to work 120 hours in a specific department where they get more hands-on experience and more opportunities to be in the hospital.
I think that Academy students should present themselves as being very professional in class, prompt with their schoolwork and their assignments, being able to communicate well with their teachers, their peers, and work well with others even if they don't know them. One of the other things is being empathetic and being able to communicate with complete strangers. Sometimes they have to interact with patients a lot of times in Advanced Med, so it's very important that they're able to communicate effectively.
My expectation of Academy students are that they're involved, that they're interested. I don't expect them to sign their life and blood saying they'll be involved in health careers, but interested and willing to explore and engage whether or not they really are.
Just to be the best that you can, to communicate with the Academy staff. Everybody has bad days and times when they need something, and that's okay.
Our students are going to learn quickly what it's like to be in a professional workplace. They're going to learn about the responsibilities thereof. They're going to have to be accountable to meeting deadlines, to working with others in a professional manner. It prepares our students really for the rigors of both college and career that they will experience once they leave here.
So for job seeking skills, you learn how to make a resume, how to get a portfolio, how to ace an interview. So you learn how to work in a workforce.
The Academy establishes a professional background where you have to look at things through a more advanced lens, where instead of just answering the question, you answer how does this apply to the real world problems and how are you going to use this to further yourself.
My personal favorite thing about the Health Academy is the fact that if I go into any room in the Health Academy, there's bound to be a diverse group of people that I can be like, hey, this person is a fun person to do this with, this person is good at that, and then I can go around and just talk to all of them because we're all kind of a close-knit family and we're all a good group of friends.
My personal favorite thing about the Health Academy was going to the hospital and doing the job shadows during advanced med, because that really kind of gave you a look at what the real world was like instead of just a classroom setting and being able to be there yourself.